Okay, hey, Dr. Fisher here. This is one of our first training videos where we're going to be training our interns on how to use our physical therapy equipment here in our office. So the first thing we're going to go over is how to use our electro stim and ultrasound machines. Now, each station here, we have 3 of these units. They only differ by a tiny little bit, but they are all made by the same company, Dynatronics. And these are all really, really good pieces of equipment where they have multiple different modalities. They have interferential, they've got Russian stem, biphasic, high volt, micro, and they also come equipped with ultrasound. So I'm going to show you guys how to use both. So if you work here, you will know how to use it, and I won't have to waste time doing this again. Okay? So number 1, we've got our leads, channel 1, channel 2. This one is just in high volt right now. This is the one that's combined with our ultrasound, but we'll get to that. Okay, so first thing is you'd come over here. Typically what our patients will get is interferential. We'll lay them down, we'll set the pads up in their area of complaint. The great thing about interferential, you can hit a broad area. So if they're having neck and low back issues, you can crisscross the pads and hit all the areas, and then you can use a sweep mode on here that'll sweep up and down their back and their spine to hit all those areas. But what I'm going to show you right now is just how to use interferential, just a basic setup. So then when you're able to come in and do it, you'll be able to do it pretty easily. So first thing you do is this. So come on over here. Let's make sure you can see the screen. Now, first button, we hit interferential. The whole pre-programmed setup comes up, and typically we'll set them down for at least 15 minutes. Also depends upon the patient, how much time they have, okay? The channels are already set up. You can see they're lit up here, channel 1, channel 2, channel 1, channel 2, which are for these leads here, okay? And all you want to make sure you do is, let's get these all undone, they get all twisted up, is now you have them separated, okay? And obviously, you know, electricity is going to run between these two and between these two, but with interferential, you want to crisscross them, so it helps to push the electricity deeper down into the body as it converts from positive to negative, okay? So what you do is you get this set up, then you grab some pads, okay? And how about here, Sierra, you pretend to be our patient. So you can lie down. We'll set this up and go face down. And watch your pin too, you got your pin on there. There you go. Well, we'll pretend like Sierra's gonna get some treatment on her low back, okay? So what you do is this, we'll pull this up, okay? So all you do is, of course, hook these bad boys up real quick here. Okay. All right, and we'll take the red leads. This is gonna be a little cold. I'm gonna put one up here, and then we're gonna put one down across the other side, down here. Okay, so we get the whole low back, and we're trying to get about the same spot on both sides, okay? Now you can see that the leads are crisscrossed. So we've got black, black, red, red, okay? In a pretty good area, which is gonna hit the entire low back. All right, now what I'm gonna do is we're gonna go back over here, and how I explain it to, you can film me if you want. So how I explain this to the patients is, I tell them, I say, okay, look, have you ever had muscle stim before? Okay, some patients haven't. What you're initially gonna feel is a little tingling pins and needles sensation. So let me know when you first start to feel that coming on, okay? Then I go over here, intensity, and I start cranking up. And now we can see that it's conducting. The conductance is actually moving that little rainbow, so we know it's working. Okay, now you just tell me, Sierra, when you feel it coming on. Okay, good. So now at level 6, she already feels it. Now what I want you to do is I want you to take as much as you possibly can without it hurting. I actually want those muscles to actually contract and kind of move and flutter a little bit, okay? So you just tell me when to stop. Just keep increasing the intensity, okay, until,
okay,
boom, right there. So now she's at 15, and you can document that in the chart. So now that once I have her set up, then I'll go and get a hot pack, and we have hydrocolloid packs. I'll put that on her low back, and the reason I do that is because when I put the heat on and the pressure and the weight, it intensifies it a little bit more. So I give them a chance to kind of get used to it. And then as I put the heat on there, combine both, it's super relaxing. It's not as great as a deep tissue massage, but it feels pretty good. Doesn't it feel good? Yeah, it's awesome. And then what you can do, so over here, now, what's great about these machines is there are 3 different modes. There's a target mode, there's a sweep mode, and there's a static mode. Okay, right now she's in target. So what I can do down here is, now, Sierra, do you have any specific spot on your back that bothers you the most?
Probably my right lower.
Right lower? So watch this. If I put my finger on there, you feel that?
Yeah.
Now watch, tell me if I hit your spot. Right there, boom.
So cool.
So now we're targeting on that spot where she has the greatest amount of pain, okay, which is really important to hit. Also too, we could do this. We could go sweeping. So now it's gonna go up and down her back and move around. Or you can do static, where it's just in that region. Okay, and then what we do, we're ready to rock and roll. We hit start, okay, and then we go back to the patient and we say, okay, so you're all set, you're ready to go. If you need anything, just scream. And somebody will come and help you out, okay? All right, super easy how to set that up. And what I'm gonna show you next is how to use our ultrasound muscle stim combo. So Sierra, you stay right there because we're gonna use you to do this again, okay?
Okay.
All right, good.